Okay, let's get into this. We're doing a deep dive today into a really significant piece of UK policy. It's the government's Fit for the Future 10-year health plan for England.
Hmm.
And the source material, it makes it absolutely clear this isn't, just tinkering around the edges. It's billed as a pretty radical plan for the NHS.
That's right. And you really have to understand the background here. There was Lord Darcy's investigation. It concluded the NHS was, and this is the quote, in critical condition.
Critical condition, wow.
Yeah, and the plan itself, it doesn't shy away from the problems driving this. Things we hear about all the time, staff shortages, obviously waiting lists just getting longer and longer.
And basic access problems, right? People struggling to even see a GP or a dentist.
Exactly that. Plus, lagging outcomes on some major killers,
Hmm.
like cancer, when you compare us
Hmm.
to similar countries. And demoralized staff, that's a huge factor too.
It paints a picture of a system under immense strain. The plan even talks about this sort of existential threat, doesn't it? The aging population, rising demand.
It does. It warns that if things don't change fundamentally, the whole service could just pass breaking point.
And the risk then becomes what?
Yeah.
That the wealthy just go private?
That's the fear laid out in the plan. If access and quality keep declining, more people will opt out. And then that core principle of the NHS, solidarity that's there for everyone,
Yeah.
that starts to erode,
So it could become just a service for those who can't afford anything else.
which leads to that really stark phrase they use, reform or die.
Mm-hmm.
The argument is, if the NHS ends up as a poor service for poor people, it loses its entire purpose. So this transformation isn't just desirable, it's presented as essential.
Okay. And this whole transformation, it seems to hang on three really big ideas, three core shifts.
Exactly. These are the pillars holding the whole thing up, and they structure our conversation today. First, the move from hospital to community.
Right.
Second, the shift from analog to digital.
Okay.
And third, a real commitment from sickness to prevention.
Got it. Hospital to community, analog to digital, sickness to prevention. Let's tackle that first one then. Moving care from hospital to community. What's the problem they're trying to fix there?
Well, the diagnosis in the plan is pretty blunt. It says the NHS right now is basically a hospital-centric system. It's fragmented, works in silos. It's not really a single coordinated service designed around the patient.
So less of a national health service and more of a national hospital service in practice.
You could put it like that.
Mhm.
And the proposed alternative is what they're calling the Neighborhood Health Service.
Okay, neighborhood health service. What does that actually mean?
It's about bringing continuous, easy-to-access, integrated care right into local communities. And it comes with a completely new principle for deciding where care should happen.
Which
The principle is care should be delivered as locally as possible. Digitally first, if that works.
right.
Ideally, actually in your home.
Yeah.
If not home, then in one of these new neighborhood health centers, NHCs. And only in a hospital when it's truly necessary.
That feels like turning the current model completely on its head. Hospitals are usually the default, the center of gravity.
It's a huge shift. And you might ask, well, how realistic is that, given how reliant we are on big hospitals?
Yeah, where's the money and the infrastructure coming from for this community focus?
The plan addresses that directly. It states quite clearly that the share of NHS spending on hospital care is going to fall.
Full. Okay.
And proportionally more investment will go into out-of-hospital care. That's targeted for the next 3 to 4 years.
Hmm.
They're talking about actually building the alternative.
Which includes these NHCs you mentioned.
Yes, establishing a neighborhood health center in every community.
Mhm.
And they're going to start in the areas with the lowest healthy life expectancy.
Makes sense. And what will these NHCs actually do? What will they feel like for patients?
The idea is that they become one-stop shops, open long hours, at least 12 hours a day, 6 days a week.
12 hours, 6 days. That's significant.
It's all about improving that basic access, like tackling that awful 8 a.m. scramble for GP appointments. We all know that feeling.
Oh, yes. So they're promising to fix that. That's a bold claim.
It is. The plan aims for same-day GP appointments for everyone who needs one,
How? Just by building NHCs?
partly, but also by training thousands more GPs. And, crucially, integrating much better online advice and booking systems directly into the NHS app. That digital piece is key.
Okay, we'll come back to the digital shift, but staying with community care, is it just about appointments?
No, there's also a big push towards patient empowerment, particularly through giving people more financial control. They're really scaling up personal health budgets, PHBs.
PHBs, I've heard of those. How many people are we talking about?
The aim is to offer 1 million people a PHB by 2030. and eventually make it a universal offer by 2035 for anyone who could benefit.
So you'd get a budget to manage certain aspects of your own care.
Essentially, yes.
Yeah.
Direct control over some of your healthcare funding to choose services that work best for you. It's about tailoring care.
And the big picture goal for this whole community shift, what are the key metrics they'll be judged on?
Well, two massive system-wide targets jump out. First, ending corridor care. Patients stuck on trolleys in hallways because wards are full.
Right, a very visible sign of pressure.
And second, restoring that constitutional standard, getting 92% of patients starting elective treatment, planned treatment, within 18 weeks of referral.
Getting back to 18 weeks, that is a huge mountain to climb from where we are now.
It absolutely is.
Yeah.
Which, naturally, leads us on to how they plan to make the system itself work more efficiently.
Which brings us neatly to shift 2, from analog to digital. And the plan is pretty honest here, isn't it? It basically says the NHS is technologically stuck in the past.
It does. It calls the NHS a 20th century technological laggard. But the ambition is huge to transform it into a 21st century leader by leveraging its scale and, crucially, its data.
And the main tool for this transformation seems to be the NHS app.
Exactly. They envision the NHS app becoming the full front door to the entire service. That's the goal by 2028. Your doctor in your pocket, effectively.
The full front door. Okay, what does that mean in practice? What will I actually be able to do with this super app?
Well, the plan details several quite powerful features. Under My Choices, for example, you'll be able to pick your preferred hospital or clinic based on things like official outcome data, patient reviews, maybe just location.
So real choice based on information.
Yes. Then there's My Consultic, ability to actually have consultations, video or otherwise, through the app.
Right.
My Health, My Care, My Companion. These sections are about managing long-term conditions, maybe uploading data from wearables, checking your records. And My Carer lets you help coordinate care for, say, an elderly relative.
That level of access and personalization relies heavily on good data, surely. Is the data infrastructure ready for that?
That's a critical point. And the plan acknowledges this with a massive foundational promise, creating a single, secure patient record, one authoritative account of your health data across the whole system.
A single patient record? That's been talked about for decades.
It has. But the plan insists this time it's happening. And crucially, it's meant to give patients proper control over their own data, arguably for the first time ever in the NHS.
And what about the staff? Does this digital shift help them or just add more screens to stare at?
The aim is very much to help them. Things like single sign-on so clinicians don't waste time logging into dozens of different systems.
That would be welcome, I imagine.
Definitely. And scaling up things like AI scribes, AI tools that listen to consultations and automatically write up the notes. The goal is clear. Free up doctors and nurses from bureaucracy. Let them spend more time actually caring for patients.
It sounds like they're also trying to create a sort of digital marketplace.
Yes, something called the Health Store. Think of it like an NHS-approved app store. Patients could access vetted digital tools, maybe specific apps for managing diabetes or mental health.
And it helps tech companies work with the NHS too.
That's the idea. Create a clear pathway for innovative health businesses to get their tools approved and offered to patients, collaborating directly with the service.
Okay, so a big digital transformation. Let's move to the third pillar, from sickness to prevention. This feels like the really long-term play.
It is. It's about shifting the focus from just treating illness to actively stopping people getting sick in the first place. The goals here are incredibly ambitious.
Such as?
Having the gap in healthy life expectancy between the richest and poorest parts of England is huge. And also raising the healthiest generation of children ever.
Lofty goals. How are they planning to achieve that? Does it start with things like smoking?
Absolutely. The plan highlights the tobacco and vapes bill, which is genuinely world-leading. It means kids turning 16 this year or younger will never legally be sold tobacco.
A smoke-free generation, effectively.
That's the aim. And they're also tackling the rise in youth vaping. The figures are stark. Regular use doubled among 11 to 15-year-olds recently. So they're planning to stop vape advertising and sponsorship targeted at kids.
And beyond smoking and vaping, obesity is always a major public health challenge.
Yes, and there's what they call an obesity moonshot, a multi-pronged attack, restricting junk food ads aimed at children, obviously, but also banning the sale of those high-caffeine energy drinks to under 16s.
That energy drink ban is quite specific.
It is. And perhaps more systemically interesting is the plan for mandatory reporting.
Reporting what?
Large food companies will have to report on the healthiness of the food they sell, and that data will then be used to set mandatory targets to improve the average healthiness of their sales over time.
Wow, so using market levers and transparency to push the industry towards healthier products.
Exactly. It's trying to change the food environment itself. Alongside that, there's direct support too, boosting the Healthy Start scheme for low-income families, expanding free school meals.
Who gets the expanded free school meals?
The plan says all children with a parent who receives universal credit, plus encouraging healthy choices through things like a new health rewards scheme and tackling alcohol consumption with clearer labeling.
So policy changes, industry pressure, direct support. What about the cutting-edge science side of prevention?
That's in there too. A really ambitious plan to create a new genomics population health service by the end of the decade, accessible to everyone.
Genomics for the whole population, what would that involve?
Things like universal genomic testing for newborns, screening for rare conditions right at birth, and rolling out population-wide polygenic risk scoring.
Polygenic risk scoring, what's that?
It's basically using your genetic makeup to calculate your risk of developing common diseases later in life, like heart disease or certain cancers. The idea is to identify those at high risk much earlier and intervene predictively, moving into real preventative healthcare.
Okay, so those are the three big shifts. Community, digital, prevention, hugely ambitious, but none of it happens without changing the underlying machinery of the NHS, right? The funding, the management.
Precisely. And the plan is very firm on this. It talks about the engine room of change, finance, workforce, governance. And the message is stark. The era of just pouring in more money without fundamental reform is over.
So a focus on efficiency, value for money.
Very much so. I mean, the NHS budget is enormous, about 38% of day-to-day government spending. So they've set a tough target. The NHS has to deliver a 2% productivity gain year on year for the next 3 years.
2% productivity gain in healthcare. That's notoriously difficult to achieve consistently. How do they expect to drive that? Are they changing how money flows?
Yes. Big changes to financial incentives. They're moving away from the old block contracts.
Block contracts. That's where hospitals just get a lump sum regardless of activity or quality.
Pretty much. Paid irrespective of quality or efficiency, often. The plan is to deconstruct those and bring in new ways of paying providers.
Such as?
Things like year of care payments, YCPs, bundling payments for managing a patient with a long-term condition for a whole year, incentivizing integrated, efficient care.
And sticks as well as carrots.
Definitely. The plan talks about withholding payments if quality standards aren't met, but also, crucially, offering bonus payments for high-quality services, trying to reward what works.
And what about the structure, the bureaucracy?
A major overhaul plan there, too. They intend to combine NHS England, the big management body, with the Department of Health and Social Care, the government department.
Merging them.
Yes. And aiming to cut the total central headcount by 50%, slimming down the center.
While giving more power locally.
That's the other side of the coin. The ambition is for all NHS providers, hospitals, mental health trusts, to eventually become foundation trusts or NFTs.
Which gives them more freedom.
Yes, greater operational autonomy. Things like being able to keep any financial surplus they generate and reinvest it locally, rather than it going back to the Treasury. More local control.
You mentioned transparency earlier in the digital section. Is that a big theme in the governance part, too?
Huge. The plan aims to make the NHS the most transparent healthcare system in the world by publishing easy-to-understand league tables, ranking providers on things everyone cares about, waiting times, patient satisfaction ratings, clinical outcomes.
And patients can see this?
Yes, accessible via the NHS app. So you can use that data when making choices about your care, linking back to the My Choices feature we discussed.
And there's something really novel about patient feedback influencing payments.
Ah, yes, the patient power payments. This is genuinely innovative, possibly quite controversial. They're going to trial a system where, after you receive care, you get contacted.
Yeah.
And you get a say on whether the full payment for that episode of care should actually be released to the hospital or clinic.
Wow. So my feedback directly impacts whether the provider gets fully paid.
That's the concept being trialed.
Yeah.
Linking funding much more directly to patient experience and satisfaction.
Okay. And finally, the workforce. We know the NHS has staffing challenges. How does this plan address that?
The strategy is shifting quite radically. There's a big focus on reducing reliance on international recruitment. The target is to get it down to less than 10% of new recruits by 2035.
So, more grow your own.
Essentially, focusing on training And importantly, retaining existing staff, giving them personalized career coaching, development plans, and leveraging technology. The plan explicitly talks about AI becoming every nurse's and doctor's trusted assistant, freeing them up from routine tasks.
Right, linking back to that digital efficiency drive.
Exactly. It's about making the existing workforce more effective and supported, not just constantly trying to recruit more from overseas.
Okay, so pulling all these threads together,
Right.
what's the big takeaway for someone listening? This 10-year health plan, it's proposing a massive shift.
It really is. Nothing less than a fundamental transformation of how you access care, the choices you have, and hopefully the health outcomes you can expect. All driven by those three interconnected shifts we talked about: community, digital, and prevention.
And it's not just about health, is it? The plan also frames this as an economic issue.
Absolutely. It explicitly positions a revitalized, more efficient, more preventative NHS, not just as a cost, but as an engine for economic growth.
How so?
By getting people healthier and back to work faster, reducing sickness absence, and also by providing a strong foundation for UK industries like life sciences, health tech, AI, genomics areas where the UK wants to be a leader.
Which brings us back to those transformative technologies the plan leans on so heavily. Data, AI, genomics, wearables, robotics, it feels like the whole model depends on them working, especially the digital interface.
It really does. That NHS app becoming the front door, the single patient record, the AI assistants,
Yeah.
they are critical components. Which raises a really important final thought, a question for you, the listener, to consider as this unfolds.
Go on.
Well, given how much this new model relies on digital access to the app, online consultations, managing your data, how does the NHS make absolutely sure that this huge push towards clicks over bricks doesn't leave people behind?
You mean people who aren't online or aren't comfortable with technology, the digital divide issue?
Exactly. How do you prevent this digital transformation from accidentally worsening health inequalities for those who lack stable internet, or the skills, or just the confidence to engage digitally? The plan says it will tackle inequalities, but ensuring digital inclusion within this new model, that's going to be a massive challenge.
A crucial point. Will the digital future be accessible to everyone? Something to watch very closely.